My risk for disease is very low. Thank you. I mean, it's different experience, right?
Yeah, I know you knew that when you said.
Well, I mean,
Oh, yeah. It's about 7 o'clock, so I'm going to try to get started a little bit. Just don't worry about if you're not done eating. And please go back and get more food if you want, because we have plenty of food. I think it's still out there. I know there's still bacon. Yeah, everybody loves bacon, right? Tonight we're going to have a kickoff of actually the beginning of the 14 steps. So Laura and I put together a method of practicing for more effective patient care. And I know you guys all know about this. You've heard us talk about it before. But tonight we're going to start sort of the kickoff, because through the next 12 months we're going to be addressing a step or two, or maybe 3 some nights, combining a few of them together. So through the next few months we're going to be really honing in on a step or 2 or 3 going forward. So tonight it's going to be mostly about 1, 2, well, it's going to be about 1, 2, and 3 tonight. So what we want to do, the phone interview, Laura and I've learned a lot from everybody that we work with. We always take a little bit from somebody and add to and take away, and so we feel like that we've gotten it down to, it's all about communication. So tonight we hopefully will help you with your communication. We're even going to have a little quiz about communication. How can we be better at actually the hook? You know, how do we hook the patient on that first call? We get one chance for first impression, and a lot of times our patients are sort of shopping, and we have to make sure that we start a relationship with that patient when they're calling to actually get them to say, yes, I'm going to come. And then if they do call another office, you're going to be the one that they really want to come to. Because I know I've done it myself, and I hate to admit that, but I have called an appointment to 2 different places and just been like, I'm going to go to the second one, and then I never get around to calling that first one back and telling them I'm not coming. So that happens to us a lot of times. I haven't done it many times. But it does happen, and we know patients do it. And so there we are with an hour and a half, 2 hours, however long you have for your new patient exam, and you're just stuck with that time open. So tonight we're really going to work on communication a lot. And then insurance breakdown. One of the biggest problems with our patients not leaving our office, accepting their treatment, and having an appointment is that we can't answer that question. What's that question?
How much is my insurance going to cover?
Yeah, is my insurance going to pay for this, right? And if we don't know how to answer that, I mean, you have to have some really on-cue communication for that. Otherwise, you just fall on your sword, because that's what they are interested in. So if they have benefit, we need to know it before we get into that situation. We want to know how to present that. So hopefully tonight we'll give you some tricks about that. And then morning huddle is really my favorite thing, because most of our clients will say, you know what, nah, we don't do morning huddle, I'm not doing it, I can't get there, doctor can't get there. And it's just a breakfast club anyway. All they do is come in and eat, talk about, last night, and they want to filter all the patients, want to talk about, I saw them last week at the Irish Festival, it's like, what? That is not what we really want to talk about this morning. We want to get ready for today. We want to be real prepared so that we give effective care to our patient. And so we're going to teach you what we feel like is a great summary. If we know the summary of the patient, then we're going to be ready for that. Really, it's a mini consultation. Every patient, we almost have a mini consultation, and we want to make sure that we're ready to present that. So these 3 steps really go together. I mean, if you can get these 3 steps and get your team to play with you on this first 3 steps, that makes all the difference in your day, and it makes all the difference in getting the patient to come in again. I know everybody knows me in this room, so I don't want to spend a whole lot of time on this, but I do want to brag a little bit about my grandson. He is at Dayton. He's a flyer now, and I'm so happy. Yeah, no flyers. And he is actually redshirted, which thrills me, because now he gets to grow up a little bit. But he is really, we're going to be in Dayton every Saturday doing that. And then my granddaughter is doing soccer every Tuesday and Thursday. So that's where I am when I'm not coaching or consulting for fashion. But we just have too much fun with the family. And it's going to always be real exciting with our little athletes. I was so lucky in 2002 for Laura to join me as my partner. She has been a huge asset. We started working together in '95 when she first graduated from LSU, and I saw that she had all that new knowledge and I had all that old experience. We were a perfect pair, and it's been that way. We've had a lot of people say, oh, partnerships never work, but ours works. And so little Jack is 6 years old. He just went to kindergarten, kindergarten. Yeah. And I was actually the first person to hold him, so he's real special in my book. Brandon and Alex. Alex is 14, which marks the anniversary of us working together. He was just a baby when we started. And then we have Julie, who you guys, where'd Julie go? She's out front. Everybody knows Julie. We employ Julie when we can to help us when we get a lot of hygiene. A big hygiene department. She's always there to help us with some extra coaching and whatnot. And so we always, I didn't mean to flip. Kenzie up there is 3, and her husband Jason. And so Julie is still practicing about 3 days a week, I think, 3 or 4 days a week. So we like to stay in practice just so that we can always tell our hygienists that, look, I know it's hard, but we do it. It can be done, and honestly, the more you learn about our steps, the more efficient you're going to be, and it's actually time management tools, not putting more on you to do. So the better you get at it, the better it does help you manage your time. So time is of essence, and it's one of our biggest really problems, I feel like, in our profession, is that everything takes time, and we're doing more and more and more and more and more in every appointment, and if we're going to do that, we have to make sure that we manage our time well. So, and then we're so excited to introduce Brittany tonight. Brittany's one of the newest members of our DHE team, and we've been working with Brittany for quite a while, 4 or 5 years. She is the lady that wears all the hats in one of our clients' offices. She can do everything, and she's learned the DHE method really well, and so we have asked her then to help some of our clients. So she's sort of new on the coaching docket with us, but we're so happy to have her tonight. She's really going to give you guys some good everyday experience and some really good information tonight. This is her son. Trent is 4, yes, and so I know that keeps her really busy, and she says that's the reason she gets up in the morning to be a better person, obviously. We all do that for our kids. Right? So you guys are familiar with the 14 steps. We know that if you practice the 14 steps, it is what we call the DHE method. The more you practice this, the more efficient, whoops, that's on a timer for some reason, I don't know what that is. The more you practice this, the more efficient you get with this. And we know that some of the results are, it will not stay there, decreased cancellations and no-shows. Just like I was just saying with the phone interview, if somebody makes an appointment with you and then doesn't call and let you know, that's big time disappointment, right? So every step is to keep these results happening. And then we get the periodontal therapy program in place so that you are treating early disease, treating gingivitis. Most of our clients, when they're new, they say, well, we do a lot of perio, but when you actually look at the numbers, sometimes it's single digits. the percentage of perio that's actually being treated. So with 88% of the population having perio, we know you should be, nationwide, you should be somewhere around 30, at least in your practice with perineal services. So we know that that will increase with practicing the DHE method. And then we have come up with the idea that teeth have infection in them as well as the gum tissue, right? So a lot of times we just feel like the patient, we feel like we don't explain to the patient how important it is to get that infection out of their tooth as well. We're all good about perio, but that infection in the tooth is just as important. So we have come up with a system of, or a technique of making sure the patient understands the consequence of not getting their teeth treated. So not getting the infection in the tooth treated is just as important as not getting the perio treated. So we will be teaching that as well in one of our evenings here coming up soon. So those are the results that we see. We actually say that if we practice the DHE method, we find clinical solutions for practice management issues. So we work with a lot of practice management companies. They come in and they say, oh, you know, your numbers are not right. The hygiene department should be doing this, and this should be happening, and this should be happening. It should be at 67% acceptance rate. And it's like, okay, how? So that's what we feel like we're a little bit unique in the fact that we come in and help you figure out how we can get those numbers in the right place. And the numbers of blood pressure in the practice, and unfortunately we have to drive those numbers. The clinical people have to drive the numbers. So we will actually be teaching that as well. So our purpose is absolutely to help others. It's mostly about helping you guys, the clinicians and the people who are actually running the practice, help you enjoy what you're doing and grow with us. The oral systemic connection is huge, and we have been asked by the medical community to help because we see our patients more. We have the opportunity to get them healthier, not only in their mouth, but through their whole body. So that's our huge passion right now, is to recruit people to get on board with us. And so this group is a really good start with that. And then just all of this is going to make a huge difference in dentistry, we hope, because it's really sad out there to either, you know, you talk to a patient who's not getting the care that you're actually giving in your own practice, and it's sad because they've been going to their dentist forever. He's the greatest guy ever, or the greatest person ever, and they are so loyal to these people, and you just cringe because you can hear that they're not getting the care that they should be getting. So we want to make a difference in dentistry, and we're going to do it one practice at a time, and hopefully one clinician at a time. So we do come into the practice, work with everybody on the team. We were just talking with these ladies that are new tonight from Stone Creek. We actually went in and worked with the clinical staff, 3 months or so, and got them some basic tools going, but they aren't seeing it in the front. The front. We need that communication with the front office as well. So that's how those 14 steps all mesh together. So we actually do go in and coach the whole team so that we work like a well-oiled machine and make more of a difference that way. So we do a lot of practice. You guys this is the lecture night, and then next month will be hands-on, and that's when we'll really practice how to use the tools that you learned about tonight. So next month, if you want to bring your administrative team, that would be awesome, because you can actually teach them what they've learned, what they've missed tonight, but then they can actually role play and learn how to use those tools they are going to learn about. So that would be awesome. So I would love to introduce Erin Packard. Some of you guys know Erin. She's our Sonicare lady. She's been our Invisalign lady as well. We're so happy to have her back in Sonicare. And so she's going to come in and I think tell us about a new toothbrush. And we really want to thank Sonicare for sponsoring this meeting tonight. They are helping with the food tonight. So that's really awesome. But she didn't know she was going to be
Caught off guard.
And please get more food if you want it.
With salad in my teeth there.
So this is Erin, who I was just talking about. I think you might know a lot of people in the room.
Yes.
And then I'm going to let you introduce Kaylee.
Kaylee, yeah. So my name is Erin Packard. I am the local Philips Sonicare and Zoom rep. I actually was with Philips for 5 years, and I left for 2 and went to Invisalign, and then came back last January. So if I kind of look familiar, but kind of not, that's why. And Kaylee just started. She covers the southern half of the state. She's in training right now, so she just happened to be up here with me this week, and I know she got to meet a couple of you who she covers your territory too. So a good thing. But just thank you all. I know pretty much all of you promote, and obviously thanks to Hetty and Laura and Dental Hygiene Excellence, the Sonacares in the office. So thank you for your business. Thanks for talking to patients about the product and home care and how it can help. I just wanted to take 1 second. Or 1 minute. We did just launch a new brush, which is FlexCare Platinum Connected. So the FlexCare has been out for a long time. It's gone through some changes over the years. But most recently, what we've done is taken a lot of feedback from hygienists and dental professionals as to what can help benefit patients in their brushing habits. And a lot of hygienists said, well, if I could only go home with them and brush their teeth and floss their teeth for them, things would be so much better. So because of that, the FlexCare Platinum Connected is basically the same brush, but now it does have the Bluetooth app to it. So it connects via Bluetooth to any Android or Apple device, and it basically coaches the patient how to brush properly. So just a little example here, if I can get this going. Kaylee's gonna actually demonstrate just by brushing. It's a free app. It just syncs directly to the brush. Hold on, of course this happens. Here, hard close that.
Yeah.
But really what it does is it divides the mouth into sextants as opposed to quadrants, how it used to. And the reason behind that is because there's an area for dental professionals to actually go ahead and circle if there's a sextant that maybe they have a lot of bleeding sites or they have recession. So it guides them through that process. It's not connected right now. Sometimes we're in an area that says turn on your handle brush. Sorry.
Technology is great when it works.
Really, normally
Bad when it doesn't.
but it does have dual sensors, so it has buccal and lingual sensors, so it can tell if you're hitting those areas and if you're spending enough time. So for example, I've been brushing with a Sonicare for a long time, so I feel like, oh, I know how to brush properly with it. But the funny thing is I'm not spending enough time in each quadrant or sextant, and I'm kind of skipping through to the next. The other is it will tell you if you are using too much motion. So many people who go from using a manual toothbrush directly to a Sonicare, they brush as they do with a manual toothbrush, which is not really what you're supposed to be doing. So it will say use less motion. It will also signify for you if you're using too much pressure. So built-in pressure sensor with this too, which is huge because obviously there's a lot of patients out there who use too much pressure. So I just wanted to share that with you. We do have the dental professional trial offer, so if anyone wants to try one out, there's a free 30-day trial. They're $65.95. They are going to be transitioning to them, so if any of you actually carry this brush in the office, it will eventually transition to the connected brushes next year. Of course, I know a few of you carry the Easy Clean brushes, which are the less expensive ones, still great brushes. But this one, because it does come with a lot of different features, multiple brush heads, things like that, tend to be inviting for patients as well. And then just the last thing, of course, Philips does offer the Zoom whitening, the in-office, the take-home syringes. We've got some great specials on that, especially with the ODA coming up, as well as the Floridex and BreathRx products too. So we'll be out here for a little while. I'll also leave some cards, so if we're not here when you exit, feel free to grab one, and I'll be happy to come in and talk to you.
What's the retail cost on that?
When it comes out, it's not out in retail yet, but when it does, it's going to be probably around, without the sanitizer, $179 to $199. And your office cost will be about anywhere from the $81 to $91 price point. So, and there's a $20 off mail-in rebate with it as well.
Okay, so clarify that for me. $65 for us right now.
Personally, like
Yeah.
the dental professional trial, you can get it for
it's, and it's this
for
one.
this one.
That's so no, and then
Yes.
it will. Can we get the app already?
That'll, yes,
So
and that's
fun.
available now, and we always have that dental professional offer, so that will continue.
Do you have your phone in your hand and brush my
So, good question.
This is getting ridiculous already.
We're trying to drive, now we're trying
And then in the beginning that they do at least the first or second time follow it because it will guide them and show them those areas. However, there's a progress report, so they can, as long as they're in the same building and brushing, they can go back and look at it and it will show areas again that they continuously miss or are using too much pressure, that sort of thing. So you can see as she's using a lot of motion and pressure, it comes up and it says use less motion, use less pressure. This area is red because I pre-programmed in that there was some periodontal disease in that area. Again, they come with script pads, so you can kind of mark it on there, and then the patient can go in and put that in there themselves. But yes, so you can go back and look at the progress up to 60 days in the past, and they can go in and actually email or text their dental professional. Which, yeah, but there are offices who, especially if you're including it in the periodontal program, where they'll all of a sudden say, well, oh, they said they've been using it, but have they really? And it's kind of just a way for them to show you. I mean, maybe they're not brushing for the full 2 minutes, maybe they're not turning it on. Who knows what's happening? Yeah, and then also changing out the brush heads is really important too, as far as the effectiveness of the brush. And there's a part in here that you can go into and it will say how many brushing cycles you have left based on the amount of pressure you're using. How many brushing cycles you have left before you need to change out your brush head. And you get points for checking that and get coupons for other Philips non-dental related products.
So are you saying if your phone is downstairs and you're brushing upstairs, it'll talk within the
It will
house?
still track it, yes. Yes. As long as you have the app, obviously.
So does this come in the
Uh-oh, here's the one.
No. So the Diamond Clean, which is the top of the line model, that does come in colors. That does not have the Bluetooth. And it's really, the Diamond Clean is more marketed towards aesthetics, and especially it helps, they are all good with extrinsic stain removal, but the Diamond Clean brush head is going to help more so than that. I would say this is more for your perio patient, your patients who need that. So then there's a touch-up. So all of these yellow areas is where she missed. So it doesn't do dual arch, but it just tells about, so it gives you the option to go back through and touch up the areas, and you can look at it.
Did you floss?
Did you floss? Did you brush? All that.
So we could program these for our patients, is that what I heard you say?
You can
For
program
periodontal
them.
disease,
Yes.
like you could actually mark, like if they had the app, and then we could go in and mark their teeth for them?
Correct. And you can do it via script pad, so that then they can go in and do it, or if they have it on their device and you take the time, you can go in and actually mark those areas as well.
Pretty cool. I can see some teenagers wanting to do that as well.
And there's goals and
So I just have to ask anybody, where's our dental hygienist over there? Right, and maybe sometimes the geniuses start to think alike, but right, I mean, I just think what a great opportunity, whether we're placing chemotherapeutics or just on therapy, right? They're asking us what? Where am I missing? Yeah, where am I missing, but also which teeth, where do I need to work on? And I know a lot of us are drawing on papers or trying to do things to let them know. I think that's pretty huge as far as perio, for them to have that visual every day.
there's focus areas here, and this is where you can go in and
How many
edit
times
it.
do you say flip your upper right? So
Six
they're like,
times.
so right here. Oh, yeah, the right.
All right, well, thank you.
Thank you so much.
Thank you.
Nice to meet you, Kaylee.
Of course, nice meeting everybody.
Okay, so Laura and I have been going in practices for a long time, and we get in the car and just laugh until we cry some days because of the craziness that goes on. And I go home and tell my husband stories, and he's like, honey, you need to write a book. Because it's really crazy. So we're always talking about doing a little spoof on things. So tonight, Brittany and Laura are going to put on a little skit about the first phone call. And I think it's going to be really what we want to do.
It's a real one. So we're gonna call it out. Actually, tonight is the real deal. We're going to be legit, but you'll have to come back in October when we're gonna walk through it for the spoof.
Oh.
So, yeah, we're not spoofing it
Don't you
tonight.
spoof it.
Sorry, we're gonna do that, quite honestly, a lot with offices when that happens. No, maybe I'll sit just this side, so we're not missing anything. So I don't know, everyone maybe saw the email. I ask all the time, is your front door locked? What does that mean? So a lot of times doctors are very unaware of what's actually happening out front. Not many doctors sit in their own waiting room that you're not allowed to call reception area, right? And really listen. I know that some people record calls or try to listen in that way. But the biggest thing that we want you to take away tonight is you're going to be hearing as we move on to step 4 is the wow experience. And something that Brittany has excelled at is starting that wow experience happens where? It's just like meeting anybody for the first time. It's that first impression. So Patty is not alone. We have all called places and decided I'm not going there, right? Whether it's for our car, whether it's for our kids, whatever it is. I mean, it could be a dry cleaner for that matter. So I think that's really important when you're analyzing your own practice and really looking at customer service is to step outside the box as a dental practice and really evaluate that as a business from a business stance of customer service. So we're going to go through the phone interview. Your job tonight, you're going to participate. The phone interview is in your packet. We're going to do a little skit, a legitimate skit tonight. If you want to see the spoof, you'll have to come back. Debbie, do you want to participate in the spoof? She's laughing back there already.
You know I'd be good at that.
Right. But you are going to be answering 3 questions, and they're in your packet here. So take a look at those. You're going to be listing for what is the patient's personal motivator, what strategy was used for the patient who's out of network for insurance, and how is the patient converted to a hygiene appointment. So we're going to take some notes during that. I want you to listen for those 3. You can also follow along on the actual phone interview if you want to write on it or take notes on it just as we go through. We'll ring the phone. Yeah, ring, ring, ring.
Ring, ring. Go off on that one.
Thank you so much for calling Dr. Sarah's office. This is Brittany. How may I help you?
Yes, I'm new to the area and I'm looking for a dentist.
I would love to help you with that. To make the best of your time, may I ask you a few questions to get you registered?
Sure.
What's your name?
Laura Bouquer, B-O-U-K-A-T-I-R,
Okay, and your address?
6957 Post Preserve Boulevard, and that's right here in Dublin, Ohio.
Okay, and the zip code?
It's 43016,
And your date of birth?
9/17/73.
Okay. And your social security numbers? I'll need this to verify insurance.
Okay, not a problem. It's 298-37511.
Did you guys write that down? And the best phone to reach you at?
I just have a cell right now,
Okay.
so that would be 614-805-6017.
Okay. And is text reminders okay?
Yes, that's actually probably the best way to get a hold of me because I'm busy with my kids.
Perfect. And how did you hear about our office?
Actually, my neighbor, Patty DeMatis.
Okay. What impressed you most?
She said your whole staff is just amazing with kids.
Okay. Are you having any pain right now?
No, well, I guess a little bit of sensitivity on the lower right. I'd like the doctor to look at.
Does it keep you up at night?
No.
Okay. When you come in, would you like the doctor to just look at that area, or would you like me to look at your whole mouth?
It's been a little while since I had my teeth cleaned, so I guess I'd like them to look at everything.
Okay, great. And how long has it been since your last cleaning?
Probably about 6 months, not too long.
And do you feel like you need a lot of dentistry?
Not really, I think just that tooth right now.
And what is most important to you in receiving care from us?
I'm not really sure about that question, but for me, one of the things that always bothered me, I feel like every time I go to the dentist, there's always something new going on.
Okay. Well, our clinicians provide a full range of services from preventative health to sedation and implants. Is there anything you'd like us to discuss for your long-term dental health?
I saw on your website that you guys actually do saliva testing. I've never seen or heard anything about that.
Well, one of the things I love about Dr. Sayota is that our practice not only looks at your mouth, but how your mouth affects the rest of your body. If you're interested, we can go over that with you in your first appointment.
Yeah, I'm very interested in learning about that.
Great. Our first available appointment is next Tuesday at 9 o'clock. Does that work for you?
No, I'm going to be on vacation, actually.
Where are you going?
We're going to Florida. We go about once a year to go see my in-laws, so it's like a family vacation we look forward to.
How fun. Well, how about the following week? Does that work for you?
Sure. What time is that?
Monday at 9? Perfect. Okay, perfect. Well, you will be very comfortable here at Dr. Sayota's office. He'll let you know everything up front, to be honest with you.
That would be great.
Okay, so the next few questions are going to be regarding your dental insurance. First, do you have dental insurance?
Yes, I do. I have MetLife.
Okay, are you the policy holder?
I am.
And what is a phone number on the card for providers? Should send it back to your card.
Oh, let me see. It's right here. Yeah, it's 1-800-896-3724.
Perfect, and there should be a group number on there as well.
It has something on here. Maybe this is it. This 37892.
Okay, perfect. Well, who's your employer?
I actually am self-employed.
Okay. All right. Well, I just want to make you aware that we are not a preferred provider for MetLife.
Okay, so what does that exactly mean?
Okay. What that means is there will typically be an out-of-pocket for preventative services, including x-rays, cleanings, exams. Something we offer for all of our new patients is an in-house new patient credit.
And how much is that?
It's $100. So we could use that to help you with this cost.
That would be great. Do all new patients receive that?
Yes.
Super.
And our new patient exam is very thorough. Please allow 1.5 hours for this appointment. Our doctor and hygienist will be able to spend quality time to get to know you. This time will also allow your teeth to get cleaned that day unless your health of your mouth indicates otherwise. And we could also do a saliva test that day if you're interested.
And how much is that?
It's $150. But we could also use an in-house credit to go towards that to help with that expense as well.
So I could use that new patient credit for that?
Yes.
Great. I'll try to remember that when I come in.
Okay. And we just ask that you arrive 15 minutes prior to your appointment to check in and get acquainted with our office. Okay. Do you have any questions for me?
No?
Are you familiar with our location?
Yep, Hetty showed me right where you guys are.
Perfect. Do you have anyone else in the household that needs to get scheduled as well?
You know, that's great that you asked because, yeah, I should go ahead and schedule my husband and my kids. So why don't we go ahead and do that? You know what? You better call my husband himself because I shouldn't do his schedule. He'll be really mad if I schedule him wrong. But let's go ahead and do the kids.
Okay. Would you like them to come in the same day as you?
No, that would be chaos with Jack. He's 6 and he'll be running all over the place. So how about we do them like sometime after school?
Okay. How about Thursday at 3:30?
That would be perfect.
Okay. We look forward to meeting you Tuesday at 9 o'clock. Thanks, Laura.
Thank you. All right. Who thinks they have all the answers to the questions? Actually, we're just going to go around the table. I just want to hear each table's kind of takeaway.
Yeah, start.
Whoever wants to start, and we'll just go around. If you guys want to start, go ahead.
Okay. So I got from personal motivator that the office was amazing with kids that you heard, and then we offered saliva testing. Looking for you. For the out of network that you get the in-house credit, $100 for new patients.
I guess I heard the personal motivator a little bit differently. I kind of sensed that the patient's personal motivation for making the treatment was lower right sensitivity, and she took care of that immediately. So that's just what I read. And the saliva testing was a motivator as well. And of course, the in-house credit was very interesting to the patient. And how was the has the patient converted in the hygiene appointment. I thought it was because she made sure that the chief complaint was heard first and taken care of. And then she talked to you about your hygiene appointment. When was the last time you had your teeth cleaned? So on what that
This last time was at the whole mouth,
yeah.
and then the last cleaning, converted into that.
We're just gonna kind of go around the room before we talk about like what we feel best, you know, and there's multiple answers, so that's just what we want to hear, what you guys heard, what kind of your takeaway was from it. How about McClatchy team?
Personal motivator was that it was a personal referral, so already you felt comfortable by making the phone call because somebody actually referred to you. You didn't position that accepted, not being a provider was a negative. You just, it was status, they were well informed, but you countered it right away to make it a positive instead of a negative.
Pretty much what I got to. I did pick up on the kids. I thought the fact that your office was great with kids and saliva testing and then the new patient credit definitely helped sway any problems anybody would have with the network costs.
You guys are so bashful, talk louder.
Oh, no, it was loud.
The whole room can hear you guys. You're giving great answers, but it's kind of.
Sorry, we're gonna keep going. Yeah. All right, let's go to the back. Where'd you guys?
What she said.
You're allowed to say that.
And I really thought her personal motivator was she was kind of new to the area too, so she was looking to find a new dentist to get to. And then the out-of-network strategy she used was she offered that extra $100 in-office credit thing. And yeah, like they said, they stuck with her chief complaint first off, but then they asked, would you want to have the doctor look at your whole mouth right away? And then converted her into the hygiene room.
That's excellent.
Well, we worked on that together. Yeah, all three.
Good job.
Group effort.
All right, middle table over here.
What she said. About what they said.
The biggest takeaway I got from that was around the out-of-network, not just the credit, but Paul's phrase, the out-of-network term wasn't actually used. It had the negative of not with the preferred provider, but it's enough to make a person pause, because when they hear out-of-network, they're just done. They shut down.
Yeah.
Just tell somebody else, because they're used to that term, but just saying not in that preferred provider makes them ask for a question, which gives you a chance to do the credit.
Okay, so what everybody said. Yeah, we agree.
How did three blondes end up all?
What was the question? Yeah, we agreed with that. We thought the personal motivator was the kids, just because she seemed really concerned about our kids and that they would be happy there as well. And the strategy for the out-of-network was the credit, the in-house credit. I mean, that's a good thing there. And then as far as converting to a hygiene appointment, it was the question I think you asked about, you know, do you want us to just look at this problem area or do you want us to take a look at the whole mouth? And we've talked about finding out what the patient does want. You know, we want to cater to what they want to have done. So I think that question was a good way to get them to what they want to do.
So you guys all did fabulous. I think the biggest thing is that personal motivators are hard for a lot of people, and there's not technically any truly right or wrong, but in this example, I kind of highlighted, we wanted to highlight it, that it was kids, that it was family, because that kept repeating, right? We called because what? They were good with kids. Then where am I going? A priority in my life is I'm going on vacation with what? My family. Right, and then she asked me to make appointments for other household members, and who did I really want to make the appointments for? My kids. So that's actually, we kind of, and it's hard, you know, we have to give our administration a lot of credit, and you'll see, we wrote listen, because there's a lot of listening that's taking place, and somebody has to be processing we say on the fly, on the go, processing that information. So that's why we're huge fans of really having your own phone interview of the questions you like,
and we're gonna talk about that. Actually, I'm gonna have you talk just just talk a little bit about why we use the term household. Where did that come from? Why didn't we ask, would you like to schedule your family? Because I think that's an interesting, Daniel picked up on our words too. We didn't say, oh, we're out of network. She said, we're not a preferred provider. So again, we're keeping that patient involved.
So I kind of feel like in this day of age, using the word, is there anyone in your family that needs to get scheduled is, can just go both ways. So asking if there's anyone else in your household that needs to get scheduled, I just feel like is more efficient with religion and family and whatnot. So that's why we chose those words.
I do think this day and age we have to look at our society. You have grandparents living with people, we have grandparents taking care of children, right? So sometimes even though we consider some things family, but it's just kind of a nice way to open the box if somebody is taking care of somebody else, that they can do that. Or where she was going in this day and age, right? We don't want to assume anything about anybody, and we want them to feel what? Welcome and comfortable, rather than feeling immediately like they have to defend themselves or say something different, like, oh, I'm not married, or anything like that. So it's, right, from a single mom to, right, somebody who, right, is of the same sex to, right, somebody who's taking care of their grandchildren. So again, we really just want to highlight some of those communications. How do I switch sides with you? Okay. I'm going to say that. I'm going to make her move sides. Okay. Then you can see right there. Perfect. So we're going to talk about the phone interview. I think the biggest concept that we want about the sheet is that the promotion. Did anyone pick up on the promotion? We really want them to leave with that they called the right place. Remember Patty? She's shopping around, right? So we want them to hang phone and be like, that's the place I want to go. And so those concepts are really all about building that relationship together. So we want that wow experience. We're going to be talking about that a lot. We want to see how much dentistry do they need. Most people don't find out too much information for their clinical team, but how much dentistry do I need? Do I think I need a lot or don't I? And I might not be a good judge as a patient, but I also may be a pretty good judge or give you a clue that I need. Because if I say, oh, I don't need a lot of dentistry, I had a bunch of implants placed and tons of work done, what should we be thinking? Do they need a lot or don't they? So there's a general concept there. I want to say, did anybody know that concept? If somebody's had a lot of dentistry in the past, that means they need a lot of dentistry in the future. So right, so again, that administration person is just thinking through those answers. Even if the patient says, oh, I don't need a lot of dentistry, I had a bunch of bridges and implants, right? You're saying, yes, you do, right? Maybe not today, but at some point you're gonna need a lot of dentistry. First, if I answer and say, oh, I've never had a filling ever done, now my teeth could be rotting out, but most likely what? Right, most likely I don't need a lot of dentistry. So that's kind of, again, those great questions that we're looking for. And then what's really important to them? What was important to Laura, the caller? What was important to me?
Kids and
The
saliva.
dentist was good with kids.
What else though?
You asked about the saliva test.
Something before that, she asked me, what's the middle question? So take a look at that. What's important to me about my dental care? If I said, every time I go and get my teeth cleaned, it hurts, what would be important to me? Keeping me what? Comfortable. But what did I say? Something's new. So that's an indication what's important to me. Knowing everything up front. See, we want to cater to each patient when they walk in the door. Most people are treating each patient the exact same instead of actually looking at what their answers were and making sure we're reiterating those answers. So she then reiterated and promoted the practice and said what? Who picked up on it?
We'll be very honest with you and make sure you know what's going on.
Everything up front. Right, Dr. Scioto is great. He'll be very honest and tell you everything up front. So again, she's giving me what? The answer I want to hear. Now, don't make it up if your dentist doesn't do that. We're not saying to lie on the phone. Some people might, but that's not, we want to have integrity. But that's that promotion. So in your information information, we really like to either promote the practice, the doctor, or the providers. So if they say something about the hygienist, I hate getting my teeth cleaned, then we're gonna promote what? Our hygienists what?
Gentle cleaning.
Are so gentle, right? So these are things that we have to have discussions with our administration is, how would they promote the practice? What could they say about the doctor? What could they say about the hygienist? What could they say about the staff? And they have to be ready for those answers because somebody is asking that in one form or another. And if you're not promoting, guess what? Somebody down the street is. Somebody down the street will. And that's what they want to hear. So am I hearing what I want to hear to make the appointment? So number one goal is to make the appointment, right? How many dentists have said, do not have a phone call, right? Make the appointment. Have we all heard that? Does that always happen? Why? Why doesn't it happen?
Maybe insurance.
So we would say the number one, and Brittany's going to talk about this. I'm going to kind of turn over to her about these two concepts and strategies because that is the number one reason most hang-ups or what we say short calls happen is about what? Insurance. We are not their provider or we're out of network and we instantly almost lose that patient. They're done. Like you said, they hang up the phone the minute it says, we are not in, right? They're already calling the next office. So we want you to be able to see, I'm just going to talk about this real quick about the phone interview. We highlighted this. Your goal at the next session will be to work on your 3 questions because every office is a little bit different. Your clinicians may want different questions than some other clinicians. Or same thing, your administration may be like, we get these calls all the time. What are the top 3 questions we should be asking to help us promote and get that appointment? So you have an example of some communication. And Brittany, I'm just gonna let you talk about, Brittany really excels at the WOW experience. So talk about this, because there's a little bit of that communication in here.
So I truly believe that first phone call, you make the connection with the patient. So Laura said she was going to Florida next week, and I want to take note of that because when she comes in for her first appointment, I really want to make it, hi Laura, I'm Brittany, I spoke to you on the phone, how was Florida? And introduce myself and like make her aware that I remember, and so like everyone can be talking about her vacation and all of it. So that's something going forward in more detail about. And then with our kids as well, just making sure her kids are comfortable in the appointment, how old they are, and what is she looking for when she brings her kids to us.
So does anyone hear that right now happening on their phone? Happening then, do you see the follow through from the conversation to when the patient walks in the door? So that's something to really listen to and kind of rate your administration. Remember I said dentists don't typically sit out and see that. That's actually one of the things that you would want to actually do, whether you're hanging out with your administration, is actually see when the patient walks in the door, how are they greeted? Just like she said, I want to stand up, I want to call them by name. She wants to shake their hand and tell them I'm the person you spoke to, right? We want everyone to know our name and we want a face with a name. Oh, you're Brittany. And she instantly knows what? Something about me. She's instantly talking to me about me. Not about here's the paperwork and here's about our office. It's what? It's actually about the patient. How different does that feel, just kind of knowing that?
Like you don't just want their business, like you really care about them as a person.
Right, so write that down, because I'm going to tell you, like Patty's telling you about Soups, we literally, I said I'm going to buy glasses and put a camera, right here, and walk into offices, because we walk in, and honestly, we have some administration, like we walk in, like us, I don't think we're scary, unfriendly people, and literally, we'll have somebody not look up at us. So you may think that's not happening in your practice, but I would challenge you on a busy day, on a different day, to just every now and then take a peek. Every now and then, come around to the front door. See what it's really like to walk in there and see how patients are really being greeted.
So talking about communication for out of network, this is a huge problem. So the insurance breakdown sheet for offering a new in-house patient credit of $50 or $100, really just to help with that first expense, because you won't know what the insurance company is going to pay and what their out-of-pocket is going to be. So it's so hard to explain to the patient. You can come here and for cleaning, do a patient exam and pull mouth x-rays, and it's going to be $18. Or it's going to be $90 because you have really crappy MetLife.
Life.
Yeah. So, and that would drive me away if it was $90 to come for a first exam. So I think offering the $100 is great. It allows the patient to get to know everyone and make that personal connection, and really why should they stay with you?
Does anyone do anything like that?
No, and that's our biggest turn away, is that we don't take MetLife, and, you know, we have them come in, and then it's, you know, we can do all bells and whistles, but it comes down to money. And when you have a family, you know, and benefits are not covered as well, they're out the back door. And I think we do a really good job of being personal and building relationship, but that is our biggest challenge, is probably MetLife.
So those are things we want to bring up, especially at our next meeting at the hands-on. Is just, even if you try some of these techniques, and that's what we want to bring back. That's what this study club is about. What's working for different people, and that's what we want to bring to you. So that, right, hey, I tried that, maybe it doesn't work in your area, so then what is somebody else doing? So that you can actually learn these best practices and start to get those types of conversions that really drive in new patients. Yeah.
And I'm just really, it's kind of technical about the credit. Like, what if their insurance, what if they don't use it all? Because then, you know, you're supposed to pay patients back if they have a credit or whatever. So do you give them money, or how do you handle that?
So we'd like to keep it on as a credit to be on their account for further, and again, that's communication. That, right, we have that ongoing credit for you to use towards your dentistry, to use towards your work in the future, because we want you to be able to come in 6 months for your next cleaning, and again, if you have a credit on your account, you'll be able to use that for that. That's what it's for. So again, we want to help you with those types of communication. So right, you don't feel like you're just handing that money out. It's a little different. This is not credit from an insurance company that, you know, right, or that they overpaid and you have to pay them back.
Over time, because
Yeah.
we're supposed to not.
It's credit that has no cash value.
Right.
A coupon card that has no cash value. That's what it is.
But I
You
don't
don't
handle
have
that money part, so I just hear things. So, okay.
Yeah, so it has to be line item in the account, just like he's talking about. People put those coupon codes, right? It's almost as if it's like
Not
monopoly
real
money. It's not real money,
Okay.
right? So nobody paid that into that, but your company, yourself. So we really want to make sure, just, I don't know, you want to answer that?
So it could really last 1 visit, or it could last 5. So as the patient was getting closer to not having a credit, I would just let them know at your next appointment, just so you know your new patient credit is almost up. You will start owing money after this appointment. And by that time, you will be able to answer for cleaning, exam, and x-rays, it's around $30, or it's around $80. And then by that time, you've built the value of, they're gonna love you, they're gonna come back and see you. Just making that personal connection. I wanna hear about your kids and your pets.
And so we are fans of the $100. Some dentists do have a problem with that. But that's so, again, typically they're going to come in for more than what? 1 visit with that. And so there's a strategy behind that. We don't want them to just experience us, what? Once and make their decision. We want them to at least have what? Multiple visits, at least twice. So maybe it was their cleaning and then maybe they had some dentistry done. So again, we're building upon that, because if they come back and still have more work done, how many people have said to themselves, I need to go find a new doctor, and you don't? Who's done that? I have. I'm not kidding. For 3 years, I couldn't find a doctor, and so I was just like, oh my gosh, I don't have time to find a doctor. I have no doctor. Call Patty, I need a doctor. It just wasn't happening. So, and I kept going back to this guy. Why? They had all my stuff. They knew me. I had work done. So hopefully they love us. But even if they don't, there is a strategy there that we really want you guys to think
If
about.
they don't, you don't want them anyways.
So is that 100 per family, not per patient?
No, per person.
Per person.
Per person, and
That's
that's
every new patient regardless of insurance. I was trying to figure out if that was,
Yeah, so
The-
Anthem, Delta, Aetna, Cigna, whatever it is, you offer it to all new patients. I mean, you may have someone call that has Delta Dental, but their deductible is gonna hit on their x-rays their first visit, and that's $43.
and then private patients. So we're gonna talk about that next, no insurance. That's next.
Okay.
Yeah, so take it away. So, all right, what if they have no insurance? We say no problem.
We offer a in-house insurance program, our Smile Maintenance Program, which can get you 2 exams, 2 cleanings, and a full set of x-rays once a year. And on top of that, you can offer 15% off additional services or 20%, perio, fillings, crowns. And then another one would be to offer a perio maintenance program for your patients that have perio, to make sure that they're covered as well. That offered 4 repair maintenance, 2 exams, and a full set of x-rays. And then you could always adjust it if they needed scaling or cleaning as well. So this is really nice. You could range it from, I would say, $250 to $500, and that's for the entire year. And I'd say when the patient buys it, it expires 1 year later. Doesn't work, it's not one cleaning in June and the next cleaning 2 years later. And that needs to be signed.
Do you have them decide that after the exam so they know where they fall, or is this a commitment when they first start?
It's flexible, so that's what she was saying. Like if they're perio and then they need to switch over to the perio bigger plan, the perio maintenance plan.
So I would have in that first appointment, if they were just a new patient coming in and you didn't know that you needed perio maintenance, then in the appointment address before the cleaning, we're going to do scaling root cleaning. And if we are, then we can talk about the perio maintenance program. So really the patient would be getting 15% off the scaling root cleaning because they sign up for the perio maintenance program.
So you guys following that? Yeah.
And I got some comments on, we just started it, and I've already changed it 6 months into it. But we started with the 2 plans, you know, the extra additional perio plan. The challenge I ran into is I was, people wanted to know how much it was going to cost before they came. So we'd go all through the plan, and it was going to be $275, then they would have their first appointment and say, well, but now it's another $100, and here's the cost of your scaling root cleaning and your sun care, and other good stuff that we did. But it was actually now easier just to give them that 20% off.
Everything flat rate.
It's flat rate, so they still get 2
Yeah.
cleanings, and they come in for that 3rd and 4th one, it's 20% off.
I think it's really about educating the patient about scaling root cleaning and perio maintenance, because the patient, they just don't know, honestly. I mean, they have no idea. So that's where you need to be strict and firm and say, you know, you have gum disease, and, you know, we can offer you the perio maintenance program. And that's really what it comes down to. And you might have pushback and say, no, we just want the in-house program. Then I would offer them a cleaning at any time for 20% off, like you said. I would just focus more on educating the patient on that and explaining it, because I find that a lot of patients don't understand what it is and why it's so important to come in for the extra cleaning or 2 extra cleanings like they're supposed to a year.
But I want to make sure I heard you right, Tina. They're still coming in. You're just making it easy on your administration. Is that what I was hearing?
Easier on the administration, or less
To
easy
track.
for the patient.
Okay.
But
Right.
because it was.
And I agree.
It was a challenge to
Yeah.
explain why it's more
Yeah.
expensive, because I've now gone over our treatment plan that has all these numbers on it, and I also tacked on another $100.
For
That's what we
the
were doing.
maintenance
is
program.
around
And I think
made
it can
more
go
confusing,
both
'cause
ways.
At that point, I just sold it on a book, and anything that would make it less
Be done.
confusing was.
Is anyone else doing a program in-house? What do you guys do?
We have a fee, and it's a cleaning, exam, x-rays, and then 20%
Do you mind
off.
sharing? I kind of know where do you
you want to share?
$259.
Okay.
For 2 exams, 2 cleanings, and full X-rays. And then what we do with perio is every other visit. That way they're not doing the 2 and not coming back. So like in 4 months, the
They
one
get
that's
to-
included, and they have to pay, but it's 20% off.
Gotcha.
And then they
I like
get
it.
1 and then 20% off, so.
That's great.
That's what we're doing.
But my thought is if you have 2 plans, and let's say they are a perio patient, well, they want to pay for the healthy cleaning program, but that's not really what they need, and it's like, I don't want them to not accept treatment because there's a cheaper way to go about it, and then it's not an appropriate care.
Well, can you just tell them that they're not eligible for that program? Because that's not really the right.
That's actually what Brittany was saying,
Yeah.
but I think those are all philosophy decisions. We really leave it up to the practice. I'm a firm believer. I think that sometimes we have to remind dentists, everybody, patients are allowed to say no. And so, right, I can't, even my good perio patients that I think are coming in for months, well, what if they don't show up? So I think we kind of, all the ifs, ands, and buts, I like, Daniel, I'm gonna say, it's one of our clients, he's doing that. And I think some is working through your community. It's like, what are our patients doing in our community with us, and get a feel for that, and kind of tweak it, cater it to kind of what's happening. That's what we want to talk about. You guys,
We have preventative care plan, and so it's X amount for, per appointment, it's kind of lined out. But it's based on, and they're not prepaying or anything, but.
it's just like a fee schedule.
It's sort of a fee schedule, but it's, they have to abide by what their hygienist recommends.
To be eligible.
Yeah, so, and this is only if you're coming every 6 months. You can't take it and then go 2 years and then expect to come back and receive it again. So it's just sort of a one sort of preventative care plan. There's no restorative approach to it, and patients love it. They're very appreciative. I mean, it's nearly 50% off.
In your office,
Yeah.
So you guys hearing that, it's more of like what I would say a fee schedule plan, but there are parameters to be able to receive that. These are the parameters. So it kind of goes along with you, Dr. McClatchy, of you saying, hey, what if that's not their plan? Well, they can only get that based on those parameters.
We've not had any complaints. I mean, they are so appreciative.
Good compliance with them returning?
Absolutely.
Well, yeah, it's
Don't
cheaper than
question
they're paying
period
a premium.
Yeah, they don't question period maintenance. They don't question, no.
So you're hearing really a couple different types, and that's what we wanted you guys to hear tonight, because we know this is the hottest topic out there. Is right, there's insurance plans. What are we doing? I was trying to keep my mouth shut with my own office because I didn't want to be a spoiler alert. But really, I think it's really, again, your community. They're deciding in their community. We don't want to make them pay up front. They're going to, these are the parameters, and then that's your fee. So you want your work done, that's what you get to pay, but you have to follow that. And then there's, plans that have more than one plan, set different fees depending on it. And I like what Daniel's being honest with you, that sometimes it's just so confusing. That's confusing to us, it's confusing to the patient, that, sometimes it's just better to have a flat rate and then a flat percentage rate for all services. So like you guys to really be thinking about those different types of plans, because too, when we come back, we want you to talk about why does it work, why does it work in your community, what's working, maybe feedback you even got from your own office.
So do you have a question? I'm just curious, do your patients pay after their appointment, or do they prepay for their next appointment when it's scheduled?
No, just pay.
Just
When they
pay
go
for
to
it.
leave, they pay just like whatever their out-of-pocket would be.
Okay.
And it works.
Smoothly.
I have a kind of related question, but it's a little off topic, but not as much. So I've had several calls recently on people with no insurance kind of calling in like, well, what are the Cigna fees? And I figured out because they're researching a $125 a year plan that gets them Cigna fees with our office because we're a network, which is, those fees are less than anything on our plan. I'm trying to figure out, well, how do I talk them out of paying $125 to Cigna at least? I don't know, give them Cigna fee, but at least give me the $125.
So that's what we want. So perfect. Lots as a group. I mean, I have already, but the light bulb went out.
I'm gonna pick on you, other hygienists, what are you thinking when he says that? What's a question? See, we want our administration to engage them. So he's saying the patient's calling and saying, hey, right, what is your Cigna fee pay? Is that what they're asking you? What would we want to ask them? So we don't want to give them an answer, we want to give them a question. What's the question?
What are you paying Cigna? Are you concerned about the coverage? Are you concerned about the cost? Are you concerned
I
about
want you to
your
go
coverage?
bigger. What's bigger? What's even bigger than going there? Are you looking for insurance? Are you looking for insurance? Are you shopping for insurance? Because we have a great in-office insurance plan. See, that I want you to think through, what are they asking me, big picture. Don't try to tell somebody, oh, you don't have money, you don't have insurance, are you worried about the cost or rate? Let me tell you what I have. We want to ask them the question so then they're like, yeah, I am, I've been shopping around, why? Because I'm going to go all the way back. What's the first thing we want you to do? Where is it? Number 1. Relationship. I have to ask you questions about you to get to know you. If I know you're shopping for insurance, then I can have a huge conversation around what? Insurance. How many places have you called? How long have you been looking? Have you ever had insurance before? Do you understand how it works?
Are you having a problem that you're focused on?
Yeah, that you're concerned about, so
looking
you can
for?
keep going deeper. Those are what we call good questions. We almost want you thinking through that. All right, so step 2, we're gonna fly through. Where are we? We're close. All right.
Almost 8:15.
Okay.
This is everyone's favorite, the insurance form.
Oh, yeah.
I know it is so hard to get all this information, but it is so important and will make everyone's life so much easier. At that first appointment, at the second appointment, when they need a crown, when they need perio. So really, if we so this is our insurance benefits form. It really goes all the way up to cleanings and all the way down to your night guard. Do they get special coverage for diabetes, which a lot of plans do. They'll pay for 4 cleanings a year instead of just 2.
Or cancer.
Yes, or if they're pregnant. And I think that's great because
Everybody know that, called
No.
specialty coverage. Highlight that. We really want this interactive. We want you guys to have huge takeaways. So you want your administration to be asking that question. Do they have specialty coverage? Because I'll tell you right now, Delta, if you're pregnant, you can come get your teeth cleaned 3 times. Just because they're pregnant, you don't have to do anything else if they have it. You just have, they know they're pregnant.
I have a patient who is type 2 diabetic, and he's perio. He can come 6 times a year.
Really?
6 times a year.
And he's pregnant too?
Wow! Now he's up to
Remarkable.
10.
Whatever you want.
Yeah, so it's there. It's tough to ask.
So really, all the important ones to highlight on here is fluoride, because fluoride is typically covered for kids and people older than 55, but a lot of times you can find insurance companies that cover it for anyone. So that's really important. The perio one is also really important now because we're seeing a lot of denials from dental saying that they want hygienists chart notes when they do therapy. Has anyone seen that? And they want the appointment length, and they want to know how long it was. So I think they're really trying to audit offices to make sure that they're actually doing what you see. So in this insurance breakdown, when you're asking questions, it's really important to say, when I submit a claim for 4341, 4342, what information do you need to cover it? And they will tell you everything. They need a perio chart, they need x-rays, they need hygienist notes, they need the appointment length, and you'll know.
So are you personally calling for, like, do you do this?
I do.
And do you get resistance? A lot of resistance, enough that makes you not want to do it?
She wouldn't be standing up here if she was one of those.
Yes. I mean, I will not do this if I have appointments scheduled or anyone talking to me.
this is a,
Oh, no.
we're closed,
Yeah,
I'm not gonna be bothered, phones are turned off,
Right.
day. Mailman's not coming in, nothing. Because I'm not hanging up on that insurance person because they will hang up on me.
That's
And do
just-
not put them on hold.
Right, that's what we're being told is, you know, it gets started and then, you know, like every, I don't know, 100 patient will find that because they initiate it and then they say they just give up because.
So there's a couple strategies. Right. I really say, you know, start at the top. You know, you want to know if they're covered for cleaning. You want to know if they're covered for that full mouth series because you don't know if they're at the dentist.
We're still finding all that out. It's
Right.
all the nitty gritty
So-
stuff about perio. And
Right. So it's
frequencies
really,
and-
as soon as you say, what do you need to cover this? If I send in 43, 42, they have to tell you. So it's just jotting it down real quick.
So that's a key thing. Most administration aren't asking, what do you need? See, they're just asking, what do you cover on 43, 41, 43, 42? So again, communication is king. You're gonna hear us say that over and over. And so that's what we want to teach the administrator.
So
I'm sorry, could you still ask the insurance company what you cover on 43, 41, and then add, what do you need for each one?
yes.
Could you do that?
Yeah.
I mean, okay.
So where they cover at 60%, 80%. Okay, great. What do you need
For that coverage.
for that coverage?
And the other thing that we found is we're getting really detailed with our questions because we're finding that, you know, some of them, you know, there's only certain things they'll cover on certain days. So if you do maybe 2 quads in one day, they won't cover it. But if you come in today and tomorrow, they would. Same with x-rays. You know, it's like 5 things one day and or a full mouth.
That should all be on there. You're gonna say, can I do all 4 quads or just 2? Can I place 4381 at initial visit or not? At what millimeters? So those are very specific questions. But I do want you to know there's strategies because I want to answer that. Strategy number 1 is they can get online and fill in majority of these blanks. But then they only have to make a phone call for 5 blanks. Strategy number 2 is tell them to send you the facts. So if you are doing something else, then you're reading the facts and again, filling in the blanks and only maybe need, again, I need an answer of 2 things because I got all the information but the nitty gritty. So now I'm not asking all that general, I've got all that. Now I just need the perio or now I just need something very specific.
So when you say they, you're talking
Insurance
about-
company. So if you're calling MetLife or Delta, whoever you're calling, they is insurance. When you actually call the insurance company.
You don't send them before.
I wish we could.
Or fax it to them, say fax it back, please. I know it's so hard to get all this information, but if you make it through it, it will make that first,
absolutely.
it'll make it so
I
easy.
don't doubt that.
And then, like going down to code 9940, the occlusal guard. I mean, who has TMJ in here? I do. I mean, I clench everything. I'm horrible. And people will come in and say, oh, like, you know, what do you want to focus on today? Oh, I clenched my teeth really bad. Let me see if you have coverage for a night guard. Well, I don't know. So if you have that, I mean, that oppression for that occlusal guard is 15 minutes. So that first appointment, I say take it.
Oh, no.
And then come back the following week. So getting through it is so easy. And then it'll make everyone's life so easy. It's just,
We started with the ones that are a couple of big employers. Start with those first. And now we'll have to make as many calls. Or the calls are not here as well.
well, you do one. Well, who's the administration here? I know it's so hard to get through it, but don't you think like once you're through it and that patient comes in and Laura comes up and says, I need to know if she's covered for a night guard. Can you check for me? And then you see that you don't have it, then you spend 20 minutes on the phone with the patient in a chair trying to figure it out. So if you just spend the 20 minutes the first time, say, oh yes, it's covered at 80%, it's going to be $100 today. Great, let's take that impression today. Come back tomorrow and pick it up.
And then we talk about long-term strategies. So what Dan is talking about is right. We have teams that alphabetize these, or by not only alphabetize, but let's say I'm MetLife. We know all MetLife by a certain plan number has what? All the same insurance. What you don't know is how much deductible I have, what I've already used, what my remaining benefits are. But if I'm on plan 1180, right here in Honda, and that's what we use because Honda is a big one for a lot of people. Guess what? Everybody on that plan has what? The exact same coverage, but they may have 5 different plans.
So you've got to know that number, and then we categorize them because you can. I'm gonna pick on Dylan. He's a great IT guy, so he doesn't have to write. He can scan and move around his computer very well. For those of you who don't like the computer, right, you can scan it in, attach it to the patient, and right can be there. And then you just find out their specifics and put that on them. So we create these what we call masters for the year.
So do you have protected time to do this? Because you said like when the phone's not ringing, when nobody's interrupting you, do you come in like when the office is closed to do this? Like when do you get this done?
I mean, I would recommend doing when the office is closed.
So some, you
staying
can stay later and do that.
That's if you're by yourself. If you're with somebody else, then what do? You delegate that protected time. Right, I'm going to go do this. I'm going to go do all the insurance forms. Do you want to share that?
Like, are you talking to me?
That both of you, either one. Delegated time.
I mean, I say block out the schedule.
Yeah.
So, I mean, you almost have to block it out so you do it. You know, allow 4 hours every Monday, insurance breakdown day. 4 hours.
It's that important. I think everyone in the office should respect that time. Don't come knocking on the door. Everyone knows that's where that person's going to be. Just don't interrupt the time. Everybody respects it because it is. It's so valuable. I mean, it's a matter of an approval in 15 minutes. That's, you know, anywhere from $600 to $900, probably depending on your practice.
And it's really saving everyone time. It's saving the patient time, the hygienist time, the doctor time.
And you can be way more productive because like you said, if I don't have a patient in my chair, it's 20 minutes to find out if they have the coverage. If I know right away,
Right.
I'm going to take that impression right away.
Right. And you can always be ready for it.
Yeah.
If the patient calls, any patient calls and says, I'm clenching my teeth really bad, right, you know. I mean, you're going to take an impression. And that kind of goes towards morning
It
huddle.
does. That's what I was going there. Which takes us right to morning huddle. How prepared are you based on that conversation? So my big spoof is, honestly, I love morning huddles. I'm going to get a camera. Because a lot of them are just breakfast clubs. I mean, literally I have people half asleep. Some people are talking in their own thing while other people are talking, right? And then we have a doctor who actually, some care and are really trying. And we have some doctors who are like on their own Facebook in the morning. And I'm like, are you kidding me? This is a business. Oh, great. You might as well just all disperse. Because I don't know what we're really trying to do here. Yet I will watch a doctor or an administration spend hours getting ready for what? A consult. A consult. And I'm like, are you kidding me? You were the same person who had 40 consults in one day, but you didn't prepare for one of them. Think about that. You're so worried about selling 16 crowns to somebody when you had 16 crowns just by 16 different people. So that's a wake up that I want the clinicians to take back to their doctors, to administrators, to really yourself. Why would you spend hours preparing for a consult just because it's a big case? Your statistics of yes are a lot lower when you have tons of little wins. We're playing football right now, right? That 10-yard line is right there. The 1 crown, yes. The 1 crown, yes. The 1 crown, yes. You get 16 of those in one day. I say, who cares about that big consult? Most of us never what we call sharpen our axe. We're never getting ready for that actual patient, for that little mini consult that we are doing at the chair. So what does that look like? For us, it's very involved. This is the most important step. If you ask me out of 14 steps, I would tell you, you want to focus on one step to change your practice, you focus on this. You focus on this one thing. And most practices do the complete opposite. What are they focusing on? What was that?
Getting out early.
Getting out early. How fast can I get through this to get this 40 minutes over so I can get my room? I'm not kidding, right?
Well, the patient to come in early had a cancellation.
That's right.
All right, so this is your mini consult. Do you know your case? Do you know their short and long-term goals? Do you know that personal motivator? Did your administrator get it? Did they listen for it? Do you know it? Stop guessing. Listen. Most of us are guessing all day long what's important to the patient. We're really not asking the right questions. Because to me, it's more of if you don't understand that question with personal motivator, then write that down, circle what's next. Why would they say yes? What would hold them back from saying yes? See, most people think it's money, but listen to what I was saying. Is it really money or is it really about my kids? See, my kids just cost me money. But it's not really money. It's what's the most important thing to me is that I would take away from myself to give to my children. See? We say it's about money. It's not.
It can't always be about money because many times if they're telling you they can't afford certain treatment, then
Well, I'm
they're
going on
telling you
vacation.
about their vacation right on the next
So we
tagline.
miss the
So-
reason why they would say yes. We're having a conversation about money
Right.
because we're so worried it's money instead of having the conversation about what? Why they would say yes.
Yeah.
I'd hate for you to get sick and not be able to provide for your children. I know you're self-employed. See, that's a different conversation. So we're gonna keep moving through there because we are going to have a little round table. And you guys are gonna actually do the case, the health link, the long-term goal, the personal motivator, or the why. And then the focus is what you actually are doing for the day. And then the opportunity is what you would present. This is what's said at Morning Huddle. Not Susie, oh, she had this great dental hygienist shirt and I really want it, her best friends, and we think so much alike, and right, we're gonna go to dinner, and oh yeah, I think she's coming in for a cleaning. Right? That's literally what happens. Or, oh, don't even bother presenting to them because he always says no. I mean, Daniel's always late, he always says no to all the treatment, and so, right. He said no to the crowns, so don't present that, or you better watch how you talk to him today. That's what we hear at Morning Huddles. Should that be happening?
No.
No. This is what should be happening. Run a business. Run a business. Sharpen your axe, because if they can't answer these questions, they're not ready to present. They're not ready for their mini consult. So you have the sheets in there to work through, and I'm going to kind of run through this fast. We teach how to put everything on a route slip so it prints out. And we'll talk a little bit more about this. This information becomes really important and usable. And then on the appointment screen, we put the focus, what we're doing today, and then the opportunity is what we're presenting. And we tell our doctors, we want our doctors to hear the total of our column, not to the penny. No, Dr. McClatchy, I'm not presenting $7,583. No, I'm going to tell her, right, I'm presenting today about $7,000. Why do I want her to hear that? Because I want to pick on my hygienist, because I want her shirt today. And right, if she says I'm presenting 1,000 and I'm presenting 7,000, what should be going off in my doctor's mind? What should be going off in my EFTA, my assistant's mind, in my administration's mind?
We're gonna be busy.
What?
She's gonna be in your room first and they're gonna be prepping ahead for.
She needs to decide, and she may decide to go and get your room over with. Why? Because there's less there and she knows she's gonna spend more time there. What's my administration should be thinking?
Get your FAs ready.
Right, do they have financials ready? What is she presenting? Do I have the treatment? Do I have the insurance form? Right, we spend so much time on that consult. Are we ready for this mini consult? It's about to walk out. I'll do the smooth. No, they get to the front desk and they're like, oh, yeah, I don't have your insurance, I'll have to call you. Well, gosh, we only knew since 7:30 that we were gonna present a crown. And we can't have it ready to go. All right, so morning huddle, you wanna sharpen your axe, this is where it's at. So, the mini consult, we say is a GPCS. We like to tell the patient something good. We think that's very important. And I make jokes sometimes. I don't care if the good is, wow, your hair looks so beautiful. Because maybe I don't have anything nice about their teeth today. I'm being ornery. I don't know. Say something good. You always lead with something good. I have my colleague right here. I'm going to pick on you, Lily. Lily is really great about that. She is just one of those people, she serves, so she constantly serves something good to them before she talks. And I think that's really important in communication, because then it leads right to what we want to talk about. Who actually uses these three words? Problem, consequence, solution. Right. I'm going to ask people who don't use those words, circle them. They're the hardest thing to get out of your mouth. I'm just like, oh my God, I don't have a problem. No. Well, guess what? They're going to come to your front desk and say, I don't have a problem. Julie.
Thanks. Teach them young. That's my daughter. She already knows how to floss. I mean, she tries. She gets in there.
So that's my screen. Are you ready? This is a hygienist in training. She is ready. She already knows how to floss some teeth right better than most adults. So I asked her, are you ready? Because this little girl, she's got it down. And she's trained her patient very well. Right? All right, so in your group, you are going to round table this case. He's 41-year-old male. He's on 3-month recare. He had perio, it's been post 2 years. He had thirds extracted in 1990, ortho completed in 99. His medical history is on metformin and Lipitor. His notes is that he's a marathon runner and has 2 kids. His long-term goal when asked was that he doesn't want to have any cavities. His last x-rays were a year ago, June 17th of 15, and his last perio chart was December of 15. You're getting ready for morning huddle. Where do you look? Okay, we're gonna look at the x-rays. We're gonna look at the photos. We're gonna look at our notes. I apologize about these x-rays. They aren't the best, but it's the best that we could do here. So we're gonna look at the x-rays, make sure we're not missing anything, and you are gonna put together your presentation. You are gonna put together, you're gonna answer to, how do you put together something good? How would you state the problem? How would you state the consequence? How would you state the solution? How would you present that? You're only allowed to use those 3 sentences when we want to hear about the presentation. And so you're going to tell us what's the case. And you have directions in there under the hygienist morning huddle. Actually explains it so you have a reference and a guide. If you've never done anything like this before, it kind of walks you through. All right, we're going to give you some 10 minutes to work on. Please raise your hand if you have questions. Brittany, myself, Patty, Julie will come to your table, kind of help you walk through. We're going to give you about 10 minutes to work on it. What? Are they not in there? I can't call it a crown.
So thank you. I've ever done this before.
So these are the facts that to know the case, the health, is restorative. So when we say case, they're either perio or restorative, usually, or they could be ortho perio. So that's like big, well, it's just their case forever, basically. Like, so if I come in, I could be like my case would really be perio because of my traumatism, punching and writing. Like, I don't have a single filling in my mouth. I've had braces since I was 15 years ago. When you restorative needs, but really my focus is really for so my case would probably be pretty hard with this patient. Just looking at the x-rays, you can tell that they've had restorative work in the past. And then it lists some facts about the patient as well that you can kind of conclude, are they perio or are they restorative? So he's had perio treatment in the past. And he's on a 3-month maintenance. So this patient is perio and restorative. They do have perio. So they still be, they can be perio restorative implant. They need to be. For the second one, it's going to be the documentation, right? What are you doing today? We're going to raise the x-rays. They alternate on everyone, and if they've already had their charting, it hasn't been here. Does that make sense? My focus today was
Right, so we say, you know, we try to use something that would affect them and blow up on you. We do 9-hour run. How's that gonna impact you? Really, that's what that motivator is. Or like, you're a busy mom, like how are you gonna have time to come over here when that was your little thing, let's just get it scheduled.
His long-term goal is not.
Do you want to use the undertake long-term goal, or do you doesn't want to do that?
She may diagnose it.
Sure.
She was diabetes actually, and medication.
Oh, diabetes,
Right, you're right. And from well, what's really, it enhances
Depending on his decay rate, yeah, that's a great point. If he's really looking for rent decay, and then what's your diet, or also keep in mind that he's a perio patient, so he's using a solid he's using a water pig, something that he needs utilize this Juice Plus, so that's a nutritional supplement, so that could be something as a runner.
Kind of easing him into that problem.
That he might be interested in as well. Right, so not everyone will have a referral, but if you obviously have someone who needs ortho or tissue grafting, like that, they need to go see someone out of the office. We like to disclose that, that's what that would be for. But not everyone does that. But obviously, in our huddle, if that patient has been referred somewhere, or if they have a relationship with a periodontist, we just want to make sure that we're clinician, especially working with them, knows the history and background of why they were referred there, or why they were referred there.
Or you're wanting to huddle last over the patient
Yeah, it is literally this fast. Like, I'm here to serve case is diabetic. We're kind of doing a little bit of a different order. So he is a runner, and his motivator is that his kids, his family, and his city. So his health, obviously, is a concern for him. We do have him on Prevalent, Sonicare, and he's not currently seeing any specialists. Our focus for today is getting the village release on the upper right. Opportunities, we can do it today. We actually have time in our restorative schedule. Yeah. The focus, yeah. So I mean, you may have a patient that comes in like, oh my gosh, they have so what are you choosing that day to focus on? We know long term this person needs a support, but we also don't want to bombard them with the kitchen sink. So what is our focus and opportunity for today?
Or maybe you're going to write down all your answers.
Focus could just be from an education standpoint, like, hey, we're going to take photos and talk about the upper right, and the opportunity is to get 2 crowns scheduled on the upper right.
She's only allowed identity.
Opportunity is also kind of like the financial opportunity.
So my thing is, I'm newer to the office, like, I'm going to say 20 years.
Sure.
But for me, I'm not going to know.
Right. So we actually, our clinicians are in charge of really creating a case, helping, and we report that to the administrative doctor. So even if they're being seen on the restorative side, so once the patient's been seen one time in our practice, I mean, you're really just editing it, like if something changes with their health link, or if all of a sudden they go see an orthodontist and they become an case. So once the information is in there, it's really pretty easy. And when we talk about our slips, actually prints are right there on the slip. We just have to go and make sure that it's still current. Yeah. What software do you guys use? Yeah. Okay. Yeah. And some practices don't print route slips or use them that way. So instead of printing them, they'll just pull them up digitally, like in the memo section. So we'll keep them there, and no one edits that section. What time do you take to review reports? Yeah. probably
in the morning or is it the day before?
Yeah, so like when our doc class people show up, like we have to be ready for huddle at 7:30. We show up and then get tea, like we had some time to save that time or a couple days before. We would just bring a copy of our schedule and check them off as we edit their stuff, just to make sure they're current. Obviously, you have your schedule changes and you fall out. So you might have a last minute add-on. Really, the condition for you is filling out that information. It should be pretty easy for you to hop in. That way, when anyone sits down, whether they're new to the office or something to do, we can quickly explain to them, this is the summary of this patient. So it is in there and having some time to prepare for it, but really when you go through, just the 8 patients in a day, unless there's a hiccup, like the doctor has a question, usually it's a personal matter, something comes up, if you get sidetracked, it takes a few more minutes, but really it only takes us a few minutes to prepare for these because it is that fast. We are not socializing in our meetings for the most part. We're really all for business meeting. So, don't get me wrong, we talk before right, when she wants to we are sipping our coffee and sipping we drink our coffee too, but you're just hearing that come out. So I want to make sure, because I'm going to give you your answer for, the case, the whole thing, which is, I know you did, that's good. I want to make They had great questions, but I mean, your instincts were right. And from an administrative side, she was kind of worried a little bit about
that. That's what everybody's going to report on, which is the same thing. It's just a quicker little summary.
Yeah.
So I'll make sure that that's filled out. And then I am going to ask you guys to do one other thing, and that's the PCS. So you're going to give 3 sentences of how you would discuss that to the doctor. So problem, consequence, solution. So what 3 sentences would you say? So I'm going to use that picture and I would say the problem with the bed we were discussing with Joe was the opening of the fillings, the dark area. He understands the consequence of decay. I'm allowed to say that in my practice, so you have to decide. That's what I thought. Some people are allowed to say cavity and decay, some people aren't. So you decide with your doctor. You could say shadow if you're allowed to say decay. He understands that that could go deeper and progressive treatment. So we discuss the solution of, again, there's no right or wrong solution. So I want to remind you that because she may do build up the crown and show the that's their own philosophy. So why we like to work with your team typically is so that you can kind of get a feel what would we say? Right, the solutions that we thought that you would recommend or the solutions we discussed in our practice, we flat out say solutions we discussed for an audience in my practice, that's going to be the build up and a crown on tooth number 29 and a filling on tooth number 30. I'd like you to take a look.
Yes.
So that's the conversation you have at the beginning. Hey, I want to give you a great morning huddle and I want to be able to talk to my patient. I really want to present. And we were taught to say problem, consequence, solution. And so, is it okay if I use the words to my patient? This is an opening and what we're seeing here is the start here is beginning to turn. Or that is a start. He doesn't like candy, so I would be using what word? And I know your long-term goal is not to have it she gives us full liberty. Full liberty. We may have another one that says, nope, that you're not allowed to do that.
I know my doctor
you get to pick your words. What I recommended, what we discussed, you're not saying I diagnosed this. You said the problem is we have dark areas. We talked about the consequence of this, of it being intentional cavities. It's just words. It's just a play on words. I'm going to be way more aggressive because I'm not. You're not. You're going to play on words. We talked about the possibility of that being a cavity. I'd like you to take a look. They have the time to say. We're not allowed to go on the chart and put, yes, they have canopy, yeah. You're just reading and things like that. Yeah.
Friday night, 7:30.
Alright, so then you're gonna write that in the box, you guys can write out your sentence. After you get all that on that back page, then you how's it going?
Having a problem they ever write, and you can use it for problems if you want. It's your own sheet. Check out the ever write. Break down
Yeah, I just want to make sure.
That's kind of the consequence, really. If you replace that filling, you could get a cavity around and spring it down. So it's kind of the consequence of that broken filling.
That's what we're going to talk about, baby steps, but it'll eventually make your life easier.
You are. This radiograph is not
I don't know.
Yeah. So you're going to base our diagnosis on the, okay. I think that's it. No, you're fine.
Alright.
So minimally,
Okay, we're going to get started and we're just going to go around and around.
okay, I think so. I'm trying to do the case. That's, and then I might be on
I don't know, maybe they are. You should be asking what is
Our people who review the film later will be able to fast forward to this part.
I started to
Ten till 9. Let's go.
Okay, we're just going to start right here and go right around the room.
And speak up so we can hear you.
Alright, so who wants to report for your team? We're going to start right here.
We're solving all of our online.
Well, that's okay, that's why you're here.
It's a think tank. It's going to be a restorative case because the prayer chart was in December, so she's more leaning towards restorative. The health link would be diabetic and high blood pressure, long-term goals, no decay, personal motivators, these kids, hygiene opportunity, do for some x-rays, and then restorative opportunity. Depending on your doctor, you could put the crown on 29 and the filling on 30, or if they're more conservative, we'd like the filling on 29 and 30.
How much money would that be? Decide you as a hygienist. What would you do? What would you do? And you actually should do this as a doctor. You should know what would they do, because you know what you would do. You want to hear why would they, and that's not for judgment, that's actually to get on the same page. Because I need to hear what you're processing so then I can explain what I'm processing.
I would frown 29. Instead of filling 30. Or present it at least. If they're like, if you're geared towards not wanting to do crown, we can try to, why don't we try to replace the filling? And then we can go to step number 2, the backup plan.
Great, and we're gonna talk about that then when Erin goes through. So how much would that you be presenting? What would you tell her? I'm presenting today. Take a wild guess. Only you guys know if it's right or wrong. We don't know.
1,600.
Great. And so the total would be at the end of the call of all of your patients. You're not going to tell her each time. It would just be an estimate of, could be 20,000 or 0 of all kids and nothing, not even the ceiling. All right. No pressure pancakes back there.
Okay, so Case is a 41-year-old male. He gets his teeth cleaned every 3 months. He's on metformin and Lipitor. His health link is diabetes and high cholesterol. Long-term goal is not to have any cavities. The personal motivator, I thought it was marathon runner or kids, one of the two. Focus for today would be to update the x-rays, do a perio chart, and a maintenance visit, an opportunity to present maybe some oral DNA, talk to them about oral DNA, possible Juice Plus, some probiotics. It's been 2 years since his last scaling and root planing. We need to look at that, see if we need to do that again. Definitely from a restorative standpoint, crown on number 29, the filling on 30. So with the crown and the filling, it'd be $1,900. If he decides to do the oral DNA, that's another $305. So.
Okay, great, but I'm going to tell you, you're way too worried for me.
Yeah.
I'm done.
Okay.
So she'll clean her up and we're going to come back. Because you know what I'm looking for. And Julie, you can help them. Great. And that's because that's my team, and we have a new team member. So you're gonna hear me. So let the rest of you, we're gonna come back to them. Go.
We have him as a perio and restorative case because he is diabetic. He's on a 3-month recall. And then restorative because the upper right side, he does have some fillings that are breaking down. His health link is diabetic, so it's something that we monitor with the 3-month recall. His long-term goal is to have no cavities. His personal motivator is we put a runner because he can't do a marathon if he has a bombed out tooth that's aching. His focus for today is going to be the broken down fillings on the upper right, also updating his x-rays. We did have openings in the schedule, so we could possibly send him over for the crown or filling, whatever they decide. And the hygiene opportunity would be to update his bite wings, fluoride, review nutrition because he is diabetic.
So his case, he's an ortho case, oral surgery case, a perio case, and a restorative case.
Okay, he's the first one to hit it, so I just want to announce that. Okay.
Health link, he's diabetic, maybe something else, let's get over. Long-term goal is to be healthy, says he doesn't have cavities, but thinks that this means he's just a healthy mouth. Personal motivator is, again, staying healthy, running marathons for his kids. Focus today, since we've had a perio chart within the last year, we're going to focus on restorative and get x-rays, even though I don't have access to the perio chart in my packet.
I asked for it.
So, in the restorative opportunity is actually going to look at the amalgam fillings on molars, present 2 crowns on those so that the doctor has a chance to back it down to a crown with fillings. So we're going to present $2,500 towards restorative dentistry.
Great. The only thing I want to give you is see if they can clean up that end. Don't live so much slower. Just tell me opportunity 2 crowns is $2,500.
This is a 41-year-old male. Case is past ortho, past perio, and basic restorative. Health link is diabetic, high cholesterol. Personal motivator is health conscientious and family. Long-term goal is to not have any cavities. Products is xylitol and Prevident. Focus for today is a 7 series. Where'd the rest go?
Talk about Mary Chart.
7 series, recare, hygiene opportunity is potentially SRP, saliva test, educate, and restorative opportunity is a crown and a filling. So we will be presenting approximately $1,600.
Okay, I made them go last. Can you hear a difference? What was the difference? I just want to point that out because they even added in more because they're used to thing I do want to coach them on too, I didn't hear specifically 29.
Oh, wow.
I want to know 2930 so the doctor knows when they walk in, they see 2930. That's what we were talking about. Not just I have 2 crowns. Not that I just have a crown and a filling. I have 29 filled on the crown. I have 30 MO. It's $1,600.
She didn't really know what
Oh.
Back me up, Mom.
Okay, did you clean up? Give me a cleaned up one. Can you tell her?
I honestly wasn't listening to them. I'm so sorry.
That's okay.
They did it. I get it now. I get the C now.
Okay, what's the C? Because a lot of people have a hard time with C, the case.
Yeah, the case. He's former ortho, he's perio, and he's in 3-month recall. So it's perio as well. So, I missed out on that. What did we say? Oh, and restorative. I'm sorry, that's what I was looking for.
So right, that case is everything that he's had done and everything he may need to do. And I'm going to pull that up for you because what if we're going to place implants? He's actually in, but he doesn't have implants in. He would be a implant case. See, that's his case. You want to know that. If he has partials, you want to know he's a partial case. He's a denture case. Now, what if you presented implants and he doesn't want them and he just still wants his denture? He's a denture case. If he's an implant over denture, he's an implant over denture case. See, most of us aren't talking that talk and we're not prepared. And then we're looking through our notes to find out what we talked about. I never have to look that up again. Why? I put what the case is, unless the doctor changes the case. It's there. Does that make more sense? All right, health link was what? So it's diabetes and what? Okay. All right, long-term goal. No cavities. Okay, what was his personal motivator?
Family, healthy family. But you know, I don't know from all the information he gave us.
What was that?
I said, maybe he has 2 kids. He didn't care about them.
That's going for it. Thank you. That's what the whole point is. Right. He's a marathon runner. I put that in there because that's like my husband. Not that the kids aren't important, but guess what? He will probably go run, then what? Lily, you can vouch for that. My husband was running the other day, saw my husband running, and I'm like, do you have the kids? No, I thought you were getting them. I mean, okay, well, you just ran 4 miles, but you didn't care to check before you left for your hour run that they might not be mad. Okay. Okay, that is a legit thing. What was his motivator? Running. Don't get him to stop running. See, we want to listen. Great. Focus and opportunity. Anybody have any issue? Who could, what time is it?
9.
All right, I want one person who can give us a great problem consequence solution. Who thinks that they could give one sentence for each thing that could sum it up? What would your consult be if you were that many consults? So I'm going to pick on Daniel. He's a manager, and I said it's a really hard job. If your team's not prepared, the greatest question you could ask somebody is, what's the PCS on that patient? Because if I'm prepared, I can look at my doctor and give her the PCS. I can tell her that means I'm ready for that conversation. If I can't give a PCS even on the fly like that, how in the world am I going to be able to do it when the patient's in the chair and I'm worried about my prophy paste that fell on the floor and my assistant who doesn't exist anymore, right, Lily? Where did she go? I have to look at Lily. Right, you know, sterilization's piling off, chaos is going on. All right, who wants to do it?
Let the front table do it.
I think that anybody can do it.
That's why they sat there.
Can we do it? Sure. Okay, they want to hear yours.
Problem with both teeth is there's fillings that are breaking down. Leaking, and there's fracture. An omnibus, whatever that was. Scary fracture. There's a scary fracture. Case is infection, larger cavity, tooth breaking. Solution would be to do a crown and a filling.
That's it. All right, she said case instead of consequence, but I knew what you meant.
Case, problem consequence solution.
All right, anybody have anything different or like to share what they might say?
So we're not shushing for the S anymore?
To
We're
make
not
sure
gonna
that-
go there, we're just learning basics.
Sorry.
Our advanced student over here.
So share Lily, because they don't do that yet.
Okay.
Share.
Is it a positive thing?
S stands for shushing, the way we learned it in a different consultancy, because it's the way of knowing if the patient is engaged. If we present the problem is, and if left untreated, the tooth might break beyond repair and might need an extra procedure like a root canal or crown lengthening, and then you silence until the patient engages and absorbs. And when he starts to ask the question, that means he's engaged and ready to accept treatment. So that's the shush. And if they don't, ask about it, they're not engaged. So when the doctor goes in, he said, if the patient is engaged, you tell the doctor, Justin has asked about what needs to be done with his problem. So we know that the patient is engaged, but if the patient is not engaged, I told or I discussed with Justin that the problem of this tooth is this, and if left untreated and it could lead, so then you turn face to the doctor because the patient is not engaged at that point. So you're giving the signal to the doctor that the patient is engaged or not, depending on how you verbiage it. So that's the shush factors.
I just want to point out too, for anybody who watches this video, you will watch it back, and people who aren't here tonight, just rewind that and listen to Lily really walk through that flawlessly. And I mean, she's done it so many times that it's really, she's probably not even thinking about what she says, but it was almost one fluid sentence, problem, consequence, solution. I mean, she didn't fumble one time. She knew exactly what she was talking about. So that's the goal, really, to get there. Obviously, it takes us a few times to get through that, remember what they stand for, A, and then B, present it to the patient and be fluid in it, and then, like she's saying, shh. But I feel like Lily really nailed it, so I'm glad that we got that on video of her just thinking out
Yay, Lily.
So we're going to talk about those strategies, because right, you guys are ready for that next strategy instead of what we call just throwing up on the patient, the PCS. But you first have to learn to throw up PCS because most of us aren't. Most of us are never telling what? The consequence. We go in and say, this is what's wrong and this is what we're going to do about it. So you have to say the consequence. And then be quiet for you would be a great challenge to get the engagement. We will teach you though to give after a certain amount of pause. We want you to engage with solution because somebody may be thinking but not speaking. So we want to go ahead. Right. We'll talk about that. We want you to give that solution before the doctor comes in so they've heard it once of the solution. We don't want them to hear no solution. All right. Anybody want to give a takeaway? You guys are good to go. Your CE is always in your packet, and it can always be emailed out to you. Love to hear any takeaways from tonight.
October 13th.
October 13th. We would like the ones that are doing the hands-on with us to bring your own case. So we would love for you to bring, just like what we did, bring a case. Bring all your, just bring in x-rays, your chart, photos, medical history. You don't have to print out all your notes, just like what we did, 41-year-old, those kind of things, and we're going to work up your case. Good morning, huddle.